I've mentioned low dose naltrexone in previous videos, but I've never actually gone in depth about it, what it is and what it does, how it can help people with chronic pain. Naltrexone was originally used at a much higher dose to help people who are drug addicts and alcoholics. What it does is it blocks your receptors, and for drug addicts it reduces the effects of the opiate drug, and with alcoholics and drug addicts it will decrease the withdrawals and make it easier to resist these addictive drugs. I'm not here to talk about that. For me, I use naltrexone at a much lower dose to help with my chronic pain caused by fibromyalgia. Low dose naltrexone can also help people with Crohn's disease, complex regional pain syndrome, multiple sclerosis, and I'm sure there's other things that it can be used for that I haven't heard about. It can also be used as an anti-inflammatory to the central nervous system. People with fibromyalgia, our body sends mixed messages about pain. So when someone is pressing on a pressure point or just pressing on us, we feel pain because our body doesn't recognize that you're not supposed to feel pain with certain things. I was on LDN last year. I went off it this year in May, I think. Now I'm going back on it as of tonight because I've been having pain that I haven't had before, and normal medication doesn't work. Like codeine, Panadol, Nurofen, they don't work. I took codeine last night, did nothing. I've had it recently since Sunday in my eardrums from the vibrations in the house. I've had pains in my eyes and in my cheekbones here and in my actual eye socket. I don't know how to get rid of that pain without taking LDN, so I've gone back on it. This medication, it has done wonders for me and is amazing, but there are a couple of things you need to consider before you go on this drug. Now, I've read up on it. I'll put the links to the websites that I've found on it in the description down below. A couple of things you shouldn't do is you shouldn't breastfeed because the medication will seep into your breast milk and go into your baby, which you don't want. Don't take opiate drugs with it, such as codeine and other drugs like it, which I think I've actually done before, which I didn't know about, so don't do that. You shouldn't drink on it, especially if you're an alcoholic, because it makes the withdrawals so much worse. Don't take it if you are pregnant or if you are thinking of falling pregnant. There are side effects, as everything has. No, I haven't had the side effects last time I was on it. Like this, it's diarrhea, nausea. It's in the information down below, so go and check that out. But I just wanted to give you a little bit more information about it. Did I just tell you? It blocks the receptors in our bodies so that we feel less pain. It takes a while for it to seep in because it's a low dose, so it takes a while. I think up to 3 weeks or a month, maybe a little bit longer, depending on the person, I guess. It is a really good drug. Definitely talk to your doctor about it because it does help pain. You can't take it if you have certain health issues as well, so mention that. Definitely look into it. I hope you know a little bit more about it after this video. The links will tell you a bit more than what I've just said and in more depth. This is my last resort. It's also really expensive in Australia, like close to $100, so it's a bit pricey, but it does significantly improve, and I found that with majority of the fibro patients, no pain medication works for that type of pain. So if you want to get rid of your chronic pain, look into low dose naltrexone. I found out about it from our chemist because doctors don't know much about it because I think it's still in a trial stage. I hope this drug helps you and gives you some relief. Thank you for watching this video, and I'll see you in the next one. Much love.